As we focus on crisis in the classroom this upcoming school year, we've learned rural Oklahoma is facing new challenges in mental health support. A program called Prime had been helping fill critical counseling gaps in rural school districts until recent federal cuts pulled its funding. News Channel 8's Christina Santiago joins us in studio with more on the impact. Christina?
Bert, the Project Rural Innovation for Mental Health Enhancement, also known as PRIME, launched in 2023 with the help of a $5.6 million federal grant to address the shortage of school mental health providers in rural Oklahoma. But with funding ending this December, that crisis is set to worsen all across Green Country. In Oklahoma, all 77 counties face a shortage of mental health professionals. The state's ratio is one counselor for every 361 students, well above the recommended 1 to 250. Brittany Hott, who oversees Prime, says the program was funded through the 2022 bipartisan Safer Communities Act. It covered graduate tuition, fees, and program costs for future counselors, social workers, and behavior analysts in exchange for working in rural schools for 2 years per year of funding.
Seeing reports of increased academic performance in reading and math as the result of having access to a school counselor or a behavior analyst. We're also seeing reduced behavioral incidents in schools and increased time in the classroom.
In just 2 years, the program has graduated 16 providers and enrolled 40 OU students. But with the funding cuts, only 13 OU students remain. Without the support, the impact hurts both students and the state.
So we need programs that support our educators. We need programs and training that put highly qualified personnel in our schools who are equipped to do the job. When someone enters a field without proper preparation, they're at risk for leaving, and that is expensive. It is so costly to our state.
The president of the Tulsa Classroom Teachers Association, Shauna Mott Wright, says the need for mental health support is greater now than ever, especially as rural schools are 19% less likely than city schools to provide mental health assessments.
And they need mental health access. They need good access because opportunity without access means jack squat. It doesn't mean anything.
As of now, the PRIME program is set to end this December, but Dr. Hott says that they're hopeful a solution will be found to address the critical mental health support needs all across rural Oklahoma. Reporting in studio, News Channel 8, Christina Santiago.
Thanks, Christina.